we now have in public health a reputation of tampering with the marketplace and tampering with people's freedoms. And we've got to, until we address those two things as a profession, and we're not about that. Environmental health is not about that. We're not about tampering with individual freedoms or the marketplace. In fact, we're pro freedoms and marketplace.
Yeah, you are. As a matter of fact, the marketplace for most DH departments, the permitting and other fees, like that's how they fund themselves. I couldn't agree with you more, and you're really hitting on the heart of something here.
Yeah, I think it's the people. Listen, I have those degrees we described earlier that I have from those schools. I never had a lecture on the public. I'm being serious.
Really?
I never had a lecture on what to do with an angry crowd. Wow. Or if you're speaking, it's always like, oh, your t-test and your p-value and your chi-square and your slide. Make sure your data is great. But you have to have great data in this profession. But you also need to interpret it. And you need to start where people are at, not where you're at.
Oh, that's so true.
Put your pocket protector and your calculator away. And what I learned, and I learned the hard way, because I worked in Southern California, as I mentioned, for almost 2 decades. When I would do community work, I would bring a picture of my wife and children, and I would sit to a business meeting, and I would like, this is my wife. She shops over here because we like to get local food from the street.
You humanized yourself.
Oh my gosh, because I tried to be Mr. Impressive PhD, and I learned quickly that
it doesn't work.
It doesn't work. It doesn't work. Be yourself. Be human. Be yourself.